Good day, good morning, and welcome to Mental Health and You. This is Cynthia Timms, and I'm your host, coming from the sanctuary and sometimes the isolation of my apartment. But this is the situation. This is the world we seem to be living in today. This pandemic has turned us upside down, turned the world upside down and sideways. And what is this new normal? What is this thing that we now in, and how is it affecting particularly people of color? Well, according to data, according to many daters, according to many reports, our people are suffering. Communities of color who already had disparities in medical care and housing and education. This pandemic is bringing to light all of those. So, be that as it may, I'm so proud and so privileged today to have on my show, to have on our show, Mental Health and You, a lady who has years and years experience in being an advocate for those living in the margins. Miss Imma Quitcon. Miss Imma is a 30-year veteran. She is veteran of advocacy of social work, a retired social worker with the Board of Education of over 30 years. She has worked diligently. She, in her work, was diligent in providing care and providing for the needs of those who are now in the margins. So I welcome Miss Imma.
Good morning.
Good morning.
And
How are you? And
I'm fine.
thank you for being part of this experiment, being part of Mental Health and You, because as we go on, I don't believe we have really even examined or even processed the total implication of mental health on of the pandemic on this our population, particularly those in communities of color who are already, in the margins or who are already on the carpet or sometimes underneath the carpet. So,
Absolutely.
so be that as it may, Ms. Emma, talk about some of your experiences. As I said in the introduction, you have over 30 years of experience as a social worker with the Board of Ed. You're now
Yes.
retired.
Yes.
You're now retired, and but in your experiences, tell me, what was that about? How did you navigate?
Well, working with the Board of Education for a 30-year period. Well, actually, from the 70s, I've been involved with social work. 1976 on to 2014 when I retired. Really, it has been a very rewarding yet, impactful career dealing with mental health issues and how they affect our community of people of color.
Yes.
And, as a community of people of color, my concerns have always revolved around women and youth and families and, disenfranchised, communities. When you come into the public school arena, you encounter a broad, of the very broad spectrum of services delivery to people in need.
Yes.
And, my job was quite challenging in having to research the community, assess what was available. And, every year it became a more challenging encounter in trying to help youth, come from families that, were already disenfranchised and trying to provide community, services one of the things that I found with young people was their resiliency. But when they encountered mental health illness, that
Mm-hmm.
was a major block. The services were non-existent. And it really continues to devastate our community, as being the one on the bottom rung. Everything has been laying on the back of these communities that have no recourse, very little recourse. The services that are supposed to be available are often not delivered in
Mm-hmm.
the way that it was promised and intended. Even basic, delivery of health services, of, just basic housing has been a challenge for our community. And all of this is compounded when we reach this epidemic. We've been in a pandemic for so
Right.
long. Our community has been in a pandemic of services not being delivered. And, each generation as they go on has really, really been challenged. I find that young people are really, really trying, and I really respect, young people that come across challenges of mental health illnesses and, being deprived of basic services in our community, which is a community. We have a community that has, but it's just, I feel, in the delivery of those services that we continue to be challenged, because I think that the services could be there, could be generated. I don't believe that there is not an opportunity to generate these services.
So
I
how would
just
you
feel,
propose to do it? I mean, if there's so you talk so how but how can they be? I mean, so what's you said the challenge this you talk about these challenges, you're talking about a population already dealing with mental health issues, housing issues, education. Now you put in a pandemic,
oh my goodness.
you know?
I think
So
being isolated,
yes.
all I can really say to you right now is that we need to create the urgency and create a delivery of services to people, because, it is affecting everybody. The longer,
Yes.
the longer we wait to try to create some real service delivery plan, I think that the creativity that exists within our community could come forward. I believe that, I just believe that the intent has not been there to focus on that. And I think we need to expect that from, our government and health services. We need to require that there be a focus on mental health services delivery, because people
And why
do
do you
get
think there isn't? Why you think that mental health sort of is still stigmatized? I mean, I have my
Mhm.
theory, based on my peer support experiences, but as from a social worker and your own experience, why has there not been an emphasis more on mental health?
Well, you mentioned one of the major issues is the stigma. And when
Yes,
a person finds themselves so depressed and so, underserved, and they totally give in, they break down, and then there is no way, no meeting. When a person is so vulnerable at that point, they're unable to harness, how they're going to address their needs for services. We're in a society right now that has become as isolated as this pandemic. We were very
yes.
comfortable in withdrawing and separating ourselves from others, and I think that after this 2.5 months of, of quarantining, we're recognizing we need to create bridges with others. We need to create programs that address those needs. There needs to be an assessment made as how to, because it's not a one size fits all.
Right.
There are many issues. There are many, many, many compounding issues that have been neglected so long. And now we have to pick up and figure out how we're going to move forward. as a community. I think there needs to be a call to get programs that will be, useful to people, that will be providing people with basic needs of, how can I get services? How can I see a doctor? How can I get mental health services delivery? The challenges are going to get greater now that, with social distancing, we're recognizing that, people cannot just, be in hordes and crowds and expect to survive. I think that I think it's a matter of us as professionals and people that are needing the services coming together and saying, I need this, and us as a society figuring out new ways, innovative ways of addressing it. I think that all exists. I think that we have to have the willingness and understanding and the compassion towards others to say, we can do this together.
And taking the stigma out of it, taking the stigma.
Stigma, I think, has been a major thing.
Yes.
It's like blaming the victim all over.
Yes.
The classic blaming of the victim. Oh, it's their fault that they couldn't do this or do that. And that's not the case.
Or they just have to try harder.
We really, as a society, have to accept that challenge, accept that we have had, the lack of really understanding that there is a way to solve this. We just haven't wanted to or felt that we could address it. I think it's become something whose time has come. It is time now to really stop, stigmatizing victims and address that as a need, a medical need. Mental health is a medical need. It's a need for someone who is vulnerable to all the challenges that we come across, and I think that this pandemic shows us when we don't have a cohesive approach to helping people come to requesting, the services that they need. We have to create these things.
How can you request it, Miss Imma? I want to follow up on that. How can you request something that you don't believe that there's an issue for? I mean, how can I tell you that I have a mental health issue when I don't even, in my community, mental health is seen upon as, something evil or something demented? I may not even know I have a mental health issue. I know I can't afford to pay my rent. I know I can't. I don't have proper food. I don't have proper education. But the idea of mental health.
That's where the professional realm of that's where I think the responsibility falls on the providers. Mm-hmm. We have a complete system that could provide. We have psychologists, social workers, we have medical doctors. That's in our realm. I just think we have not been able to enforce or provide these because of the mindset of a society that we're in. But I think it's something with this pandemic that we can address. I believe that this is a good time. This is a positive time to take away all those expectations that people are supposed to not need it. I think that that's been a neglect and an ignorance on our part. And I think that every crisis that we come across has a silver lining. And I believe that this could be an opportunity to take stigmatization away from, basic needs of mental health and begin to provide that. Mm-hmm. I just really think that this is a clear opportunity. It's a crossroad.
And it's interesting because what we do on this show, that's interesting. What you just said there, I want to follow up because what I do on this show, at least what I try to do, I try to broaden the scope of Miss Imma of what mental health looks like. You're talking about
I think it begins with something like a pandemic.
Yes.
how is the challenges of mental health, and not being
Well,
able
surely
to
a
clearly.
pandemic has put a highlight on it.
Exactly.
That's
And
what
I
a
agree.
pandemic, I think it's always been here. It's always been in the
It's
mix.
always been here.
You
And I
know,
think this is an opportunity to say, during this pandemic, we've come across an overwhelming amount of people whose needs have been neglected.
mm,
And I think that this is an opportunity to step forward with a new focus and an agenda in the health services deliveries to provide this, to assess it and provide it and to begin to give people hope. I think that it's a doable challenge, for us to take this opportunity moving forward. And it's going to be a creative venture for all of us to
mhm.
say, but I think the main thing is that willingness and that understanding that it is beyond people's control to address all these things on their own. I think people have to be recognized as having the need. Just like, people go every 6 months, a year for a checkup. I think
Yeah.
that there needs to be a mental health checkup. That's one
Mhm.
of my innovative, very simple approaches, mental health checkups. Okay? Every year. How are we faring mentally? How is, our outlook in life? What do we need? Because somebody may be depressed, somebody may have personality disorders. I mean, the DSM, 5 addresses all that. We don't, it's not our position right now to say, okay, this person, but if we are encountering it as a matter of course, I think people will begin to give way to destigmatizing people's mental health needs. I think it
Mhm.
has to be approached as an everyday need of a human being. Their mental health status is affected by how, the world is right now. And obviously, this pandemic is going to highlight those people in the most vulnerable positions in our society.
Right.
And I think that it behooves all of us to provide that because these are our brothers and sisters in our family and our spouses and our family members, that are going through this. I think we may find ourselves in a position where we need mental health services. And I
Absolutely.
think that as we elevate our own conditions, coming out of this pandemic, we have to recognize people need mental health assessments. They need to know where they stand and what they can do about it.
And they
We
also
have some
need
of
to
them.
know, Miss Emma, they also need to know that it's a form of strength. It's not a weakness.
Absolutely. Yeah,
You
that's
know?
but a lot of people, when they come to terms and realize they need the help, they find the help is not there because it's not accessible because, there's been such stigmatization and ignoring,
Mhm.
basically, the ignoring of these needs and not acknowledging that people have a need. And I think that we need to standardize and expect those of us that are in positions to say, people need a mental health assessment along with a physical assessment of what they're needing. And then we have to creatively begin to address those. We've had those challenges before. We've had pregnancy amongst our youth. We've had, HIV, pandemics. We've had, all kinds of issues that have come up. And once we acknowledge that it is an issue, then we begin to create. But I think that we have not, given people, and people don't want to open up that can of worms. Well, the can of worms is already open, and we need to address it.
Well, it's
I think
also
we need to move forward.
Well, also, don't you believe? I know it's been my experience, particularly coming up in the church, that
Hmm.
um, you just don't put your business out there to anybody.
No, and that's why I think it should be, professional. I think it should come
Right.
from the health
Hmm.
industry, as an approach. The challenges on our health delivery system are going to be huge in this way, because if we all accept that we're all vulnerable and we all can, have needs from, like everything else, to balance our health, then the mental health is a component of that. And I'm a proponent of making sure that we make that a balanced approach. As we address everything else, we want our children to have physicals to begin to accept, vaccinations and so on. Mm-hmm. But we also have to acknowledge that certain people in our society and in our group need mental health assessments, need to have that more standardized and not stigmatized for those needs, because that is a major, problem. When
and putting your business out there to the right person.
It's not about putting your business, because it should be confidential, just like a physical is.
Right. That's what I'm trying to get to.
Hand in hand. It goes hand in hand.
Right.
We have to protect people's personal vulnerabilities. We should not be exposing people. It should remain a confidential health issue. And it should be balanced as the vulnerability of a human being. It should not be, where we are judging people because they have needs. Again, it goes back to blaming a victim for their problem. And that has been the ignorance on the part of society. Mm-hmm. We have to break through that. And I believe that this pandemic can offer us an opportunity to just look at it from another vantage point and say, okay, this is a time to say, we should be giving people mental health assessments as a matter of their health course, as their health is assessed. When people are not well, how are they faring emotionally and mentally? And I think once we standardize that, it makes it that much easier, because it's not about getting in anybody's business. It's about helping a human being in need.
Absolutely.
And destigmatizing it and just saying this person has a need.
Right.
But I could be that person, in need. Anybody, any human being is vulnerable. And, we're not omnipotent. We are people that have needs. And as human beings, and coming out of this experience, we're going to see a lot of people have not done well with this. Those of us that are blessed and, have healthy, balanced situation, that's a blessing. But that's not the case for everybody.
No,
that is not the case.
Ms. Imma, in these last 5 so minutes that we have left, and I want to thank you, and we got to do a part 2 real soon, as soon as possible. This quarantining that we're being asked to do, it's hard. It can be isolating. Yeah. As I started the show, I talked about, I was bringing, this show was coming from the comfort and also the sometimes isolation of my home. I'm one who needs engagement. I'm one who needs to be involved.
Absolutely.
And this can be a blessing. It can also be very hard.
Mm-hmm.
And what's been helping you?
Well, I don't think it's a one single thing. I think it's a total outlook, wholesome outlook. And, I've always looked at everything in a wholesome way. There are a variety of things, that come up for us to address, faith-based, just having the support of a family. Generating, and like being a person like yourself, reaching out, reaching out and knowing that there are people on the other end of the line that want to help, that want to, we all realize that if we don't help our community, the stronger and healthier ones of us, we're all in this together. And then that person can get healthy and help someone else. But we really have to all, symbolically begin to reach forward and say, stigmatizing for mental health issues is not going to be the impediment, because we're all going to take, responsibility for the vulnerability of being a human being and being, at a crossroads and being in a position where our mental health gets challenged. just
Right.
like anything else. It is not the, we're not the culprit is not the victim. These are two different, positions. And if a
Right.
person is being victimized, not that they want to take the victim role, but they do want the services that are necessary to get better and to begin to address things in a more positive manner. Because
No.
we don't want people to come out of this and be so discombobulated that they can't even, decide what step to take next.
So
We should already have engaged and said, we recognize that this is going to create mental health challenges for people, and we want to provide that.
So we want to provide, yes, we want to provide those outreaches, those support.
Exactly. And those assessments, and to put mental health as a central, factor in readdressing how we're going to come out of this on a better, approach. We know that people are going to come out feeling lonely, feeling vulnerable, having lost people, having lost resources, and we need to begin to look at it as how we going to, as a community, approach addressing these problems that are going to be coming up. We're going to come across issues that we could not have anticipated, but we have to be ready with the proper attitude towards those things.
We have to be ready. We have to be
ready and cognizant and be willing, and not, allow ourselves to continue to join that, mentality that it's their fault or whatever. No, when you say to someone, how are you feeling? What's the matter? They'll tell you what they're feeling. But if society as a whole is unwilling to, because we all create, our realities and saying, this person is in need of service.
Ms. Imma, we can go on all day about this, and that's what we're going to do. But I want to thank you, because we got to start to wrap up mental health and youth for today. But I want to thank you, Ms. Imma Quitcon, 30 years, clinical social worker for the Board of Ed.
Right. It was 30 years with the Board of Ed and 10 more years of community services before that. So it was actually 40 years. That was my career, 41 years. I get
41 years. I want to tell everyone out there, continue to take care of yourself.
That's right. I believe that. Thank you.
See each other again. I wish you peace and blessings.
Same here. Same to you.
Alone. God bless. Be well.
Bye.